I want to talk about clinical trials for a minute. We have to remember that experiment is a respectful term. All major advances in breast cancer have resulted from breast cancer clinical trials. A classic example is breast conservation therapy. We know from heroic women who 40 years ago were willing to be on a trial where half got mastectomy and half got breast conservation, meaning lumpectomy and radiation, that there is no difference in survival if they meet the criteria for this. Those women have improved the life of women with breast cancer, and these clinical trials will also do so in the future. Sometimes we hear stories about a patient who did well or did not do well, and that are anecdotes, and we want to emulate those. We should be aware that the plural anecdote is not evidence. NCCN believes that the best management of any patient with cancer is in the clinical trial. Participation in clinical trials is especially encouraged, and that's on every page of our guidelines. Well, we've talked briefly about some of the science, but there's more to taking care of a patient than just the science. There's the art of taking care of patients. Taking care of breast cancer patients is not science or art. It's a combination of both. There's some phrases that I like to remember. Not everything that counts can be counted. Though we care passionately about rigor and science in the clinical outcome, we know that there are more important things. People have other things going on in their lives. An ethicist once told a group that there is more to life than serum potassium. We care more about you and how you feel than what your blood level of some things is. A patient transferred to me about a decade ago because they said, sometimes you want to hear more than scientific stuff from your doctor. As I go through my interactions with patients and with others, I try and remember this quote from Emily Dickinson, something I strive to do, hopefully, more often successfully than not. She said, sometimes when I consider the tremendous consequences from little things, a chance word, a tap on the shoulder, or a wink of an eye, I'm tempted to think there are no little things.